Shaftesbury campaign now, from the wonderful campaign over in Shaftesbury. I'm really pleased to welcome Julian, Lester and Steve from the Save Our Beds campaign. They've worked tirelessly over in Shaftesbury to do exactly that, to save beds from the Westminster Memorial Hospital. They've worked across political parties, they've had their own shop, and I don't want to say any more because I'm sure they're going to tell us all about this. So a big round of applause. Thank you very much.
Katie, thank you very much for that introduction. Damien asked me today to come and speak to you a little bit about how the campaign got off the ground, and I'll keep it as brief as possible because it's not so much about what the others are talking about, it's a bit about how we started off. So really, chance, passion and community are what created this campaign. A chance meeting with a volunteer when I was on a walk led me to getting involved with the Westminster Memorial Hospital garden and then finding out what was happening about the beds. The CCG consultation document had not arrived on my doorstep. I hadn't heard about it, as we found out a lot of people in Shaftesbury and the surrounding areas hadn't done, despite them telling us that it was well publicised. I then attended a CCG meeting where I became so incensed that I got over my total shyness and inability to speak in public and stood up and said my piece. And from there, it led on. But the CCG had been attempting to explain why turning the Westminster Memorial Hospital in Shaftesbury into a hub without beds was positive and beneficial for the community. We couldn't understand why. From that point on, I was determined that I would not let an overpaid accountant destroy our first hospital beds since Henry VIII destroyed the infirmary of our Benedictine Abbey. I can assure you that Tim Goodson may be all-powerful as the chief officer of the Dorset CCG, but he is not a king. Sorry? Oh, sorry. Oh, closer, sorry. A little bit of delving uncovered that a resident of Shaftesbury had previously collected a 3,000 signature petition, but unfortunately that petition was equivalent to just one CCG consultation questionnaire being returned. I decided that I would aim to double that number of 3,000 in return questionnaires and began to formulate a simple model that would deliver and collect a questionnaire to every resident in Shaftesbury and the local villages and towns around. We would have a committee and street reps armed with clipboards, pens, instructions, arguments against the CCG documents, consultation documents, checklists and petitions. This would allow the street reps to be efficient, know who they had visited and who they had collected from. The 29th of December, I took the plunge and bought every residential and business address for the whole of the SP postcode area and promptly crashed my computer. After I fixed my computer, I tested the model and had a shock. I was meeting all my neighbours, but was averaging 2 questionnaires an hour, which wasn't going to get me through the whole of Shaftesbury. So on the 10th of January, armed with our Save Our Beds flyers, 3 of us went to a CCG drop-in event and started recruiting. 2 days later, I was drinking an awful lot of coffee with the chairman of the Westminster Memorial Hospital working group. From there, I started fundraising and ordering the kit I needed to make the campaign happen. The 30th of January, now bear in mind this is less than a month before the end of the consultation period. The 30th of January, I briefed my first street representative and the campaign began. Later on that week, we acquired a headquarters in the High Street. 29 and a half days later, a small group of us had worked tirelessly to recruit over 200 volunteers and collect in 5,345 completed questionnaires. That was 180 every single day of those 29 days. We also knew that the CCG had received 570 questionnaires and were berating us for the poor response when they claimed to have sent out 20,000 consultation documents. Well, we didn't tell them that I had several thousand under my desk. So at the end of that campaign, we have returned at least 6,000 completed consultation questionnaires, which is a third of the entire of Dorset. So where next for the campaign? Firstly, we would like to merge with all the other campaigns here, and we'll be talking about that later on with the campaigns individually, so we can share our experiences and speak with one unified and unfaltering voice to the CCG. Secondly, We have plans to film residents discrediting a number of CCG assertions, which was mentioned earlier, I think. Thirdly, we're contemplating a march along the lines of a pilgrimage where we all set off from our homes and we march and descend upon Vespasian House in Dorchester. That's quite a logistical nightmare, but again, we can look into that. We're planning lots of publicity stunts such as bed races, which if we can combine across the whole of Dorset will be much more effective and create much more of a news storm. On a serious note, we are trying to run a civil, honest and fair campaign so that we do not inflame the CCG to such an extent that they will not engage with us and communicate us and therefore affect our ability to have pressure on them and also implement or suggest other possibilities to their suggested model. We're also planning, and this is where we might like your help, a national petition to demand that Dorset CCG trial in North Dorset their simple concept of keeping patients at home from needing hospital beds. And if 2 years after implementing this test, happily in North Dorset, we suddenly find we have no need for community beds, we'll put our hands up and say, we were wrong. But if we weren't wrong, we still keep our beds. You resign that model of keeping your patients at home to a desire rather than a possible substitute for hospital beds, and no patient is injured in the trialling of this. And if that works, either way we get a better outcome. If all else fails, the gloves will come off, and as one of our local MPs said, there will be a God Almighty row. So if you would like to chat to us, come and see us. We've got a little stand under there. If it's raining, you're more than likely to come and hang out with us anyway. I would also like to introduce now Lester Taylor on my right, who is our Deputy Mayor in Shaftesbury, has been very involved, as is Steve Unwin, with the campaign from the start. He's also part of the Westminster Memorial Hospital working group, and he knows a lot more about how the working group has been involved. The Save Our Beds campaign is just one small portion of the campaign, one small part of it, and we have simply been there to return the questionnaires and put up a fight, and that's what we've done. So it's been only with the help of people like you out and around that we've managed to achieve such an awesome return. And I beg you and plead with you to keep campaigning till we keep the beds, the units, and the hospitals and the NHS that we need to keep for the future of this country. Thank you very much. May I introduce Lester Taylor.
Good afternoon, everyone. It's absolutely wonderful to see you all here, and I want to give you all to give yourself a round of applause for taking a Saturday afternoon out to actually support the NHS. Please. Now, as the Deputy Mayor of Shaftesbury, I'm a town councillor there, and that means I'm involved. Now, a lot of councillors sort of shy away a little bit from this sort of thing, but our council decided that we were going to take this on. So the 12 of us got together and we resolved that we were going to fight to keep the hospital beds open in the Westminster Memorial Hospital. We resolved to do that. We put money aside to do it. We put time aside to do it, and we put admin support aside to do it. Now, my message here is that contact your councillors, don't leave them out the loop. It's up to them if they decide then to be out of the loop, but get them involved. Tell them, go to your parish councillors, go to your county councillors, and go to your district councillors. They will help you if you insist that they should do so. After all, you vote for them, get them on your side, and also your MPs. Now, the good thing about having a council on your side is that they've got some money. They've got inroads into members of parliament. They can write letters with democratic weight behind it, and that's the most important thing. So when you're thinking about these campaigns, get your councillors involved as early as you can. And it was really great to work in this way because as soon as I heard about this potential hospital beds closure, I decided to do something about it at exactly the same time that Julian came up with his idea, and we were able to quickly mould them together and make a massive force which actually engaged everyone in Shaftesbury, which was fantastic to see, and we've had a fantastic result from it. So please don't forget the democratic process. It is there to help you if you use it. Okay, thanks very much for listening.
Hello, I'll just add one thing to what the others have said. and that is that we've made sure that for our Save the Beds campaign that we've treated it as entirely cross-party. We all put our political badges away, and the thing is, the National Health Service is a cherished institution. It is not a bandwagon, and it is not a political football. And as soon as you start turning it into either a bandwagon or a political football, then I'm afraid you turn people off. So that's what I would say. But we've kept it cross-party, and we've all put our badges away.